Basically, when we say anti-thrombotics, ayan, of course, anti means prevent. Diba? Pag may tag-anti, meaning na prevent. Okay? So, anti-thrombotics, they prevent formation ng thrombus. Diba? Then thrombotics, they prevent formation of thrombus. So, tawag natin sa mga gamot na yan, again, is anti-thrombotics. Okay? They prevent formation of thrombus. Now, ang mga antithrombotics, ang ultimate effect ng mga ito is bleeding. Take note, ilang ultimate effect is bleeding. Okay? Kasi nga, again, antithrombotics, pinipigilan nila yung pagbuo ng clot. Okay. Now, meron tayong dalawang classification ng gamot under antithrombotics or so-called as antithrombotics. So, number 1, again, naatay duha ka subclassification of antithrombotics. Una is the antiplatelets. Okay, I think one word yun na siya. Antiplatelets. Platelets. Tama ba? Platelets. Tama ba? Ayan. And second, we have the anticoagulants or the anticoagulants. Ayan. Again, meron tayong dalawang classification under antithrombotics. We have the antiplatelets, the anticoagulants. So, mauni sila exactly ng mga terms ang misused. Okay? Sa mga students. Sometimes, or usually, ang terming nga ginagamit na term is yung anticoagulants. But what is really the difference between these two terms? Actually, naagad sila difference. But there are also similarities between the two. Okay, so inanin niya siya. Nadumduman tong first and second major events of hemostasis. Very important yun. Okay, very important yung events na yun. Yung first, tsaka yung second, yung 1, 2. Okay, first, second na events. Very important to siya upon understanding these two groups of antithrombotics. So, tandaan, kapag ang target gani sa gamot is ina-alter niya yung function ng first event, ayan, kung iyang gina-alter gani ang function ng first event na siya ha, first event, ayan, or iyang gina-alter anything that involves platelet migration and aggregation, di ba? Yan yung first event. Ang gamot is classified then as anti-platelets. Again, kapag ang isang gamot, it alters anything that involves the first event in hemostasis, that is classified as anti-platelets. Okay, this is also the reason why antiplatelets are also called anti-aggregants. Diba? Sometimes pa sa antiplatelets, ginatawag po sila as anti-aggregants. Ano siya ha? Anti, then hyphen, then aggregants. Okay, again, antiplatelets. Again ha, antiplatelets, anti-aggregants, they target the first event of blood clot formation, yung platelet migration and aggregation. Now, para mas ma-enlighten mo, maghatag og example. For instance, antiplatelet ang isang gamot kapag kaya niyang i-block yung thromboxane A2. Okay, naalala? if you remember, ang thromboxane A2, TXA2, isa siyang aggregating substance. So, involved ang substance na to sa first event. Therefore, if a drug targets thromboxane A2, that drug is classified then as antiplatelet. Okay. Another example, if ang gamot is glycoprotein inhibitor. Okay. Kapag ang gamot ay isang glycoprotein inhibitor, remember, kapag glycoprotein, di ba, important siya sa first event. Okay, always na siya dumdumi na ang glycoprotein, ine-express yan ng mga platelets. So, under siya sa first event. Okay, therefore, ang usa ka drug targets the first event, then this is classified then as antiplatelets also. Another example, yung kapag ang drug ay isang adenosine, ADP na lang siya. Okay, adenosine diphosphate. Adenosine diphosphate, let's say inhibitor. Okay, adenosine diphosphate inhibitor, isa din yang antiplatelets. Diba? Kasi adenosine diphosphate, isa ding aggregating substance, pro-aggregants. Okay, so involved under sa first event ng hemostasis. So, this is also an antiplatelet. Okay, so if a drug targets thromboxane, if a drug is considered glycoprotein inhibitor, adenosine diphosphate inhibitor, these are considered antiplatelets. Next, let's have anticoagulants. Ang anticoagulants naman, ang gina-target ng mga gamot ay coagulant is yung coagulation cascade. Okay, ibig sabihin, tina-target niya yung second event of hemostasis. Okay, excuse me. Now, malalaman natin na anticoagulant ang gamot if kaya niyang i-alter, okay, or tina-target ng gamot yung clotting factors. Okay. Again, kapag ang gamot inalter or tinarget ang clotting factors, that is considered anticoagulant. Example, kapag mechanism of action, kapag yung mechanism of action ng drug is it blocks na siya, ha? Wag na lang X, minus na lang. Okay. Example, if ang drug blocks 2A, okay, or a clotting factor 2A. Recall nga ang 2A is said to be a clotting factor. This is thrombin, diba? Involved in coagulation cascade, involved in the second event. Therefore, we could conclude then na ang drug is said to be an anticoagulant. Okay? So, kapag ang gamot targets the first event, you should not call it anticoagulant. Okay? Magkaiba yung targeted area nila. Okay? But please take note na ang end result ng dalawa, the same. It's bleeding. Okay? Bleeding pa rin. So, mo ni siya ang reason nga nung na ay common misconception. Okay? Na kapag nagkukos ng bleeding, anticoagulant diretso ang tubag sa student. Diba? But that is very understandable, no? Na misconception. Pero karon, kung mahuman ninyo ang pharmacology 2, biskan kani nga topic, dapat aware na mo sa differences ng antiplatelet saka anticoagulant. Magkaiba yung mechanism of action nila, but the same yung net result nila, which is bleeding. Okay? So, Here in this lecture video, you'll be able to distinguish which drug is an antiplatelet, which drug is an anticoagulants. Okay. So next, second group of drugs are the thrombolytics. Okay, thrombolytics can also cause bleeding. So take note nyo ha. Thrombolytics can also cause bleeding. Okay. And regarding thrombolytics, ginagawa nila is they break, diba? They break the thrombus. Lytics lysis, so they break the thrombus. Okay, based on the term itself. Okay, specifically, may kinalaman ito sa plasmin pathway. Take note. Thrombolytics, may kinalaman ito sa plasmin pathway. Okay, so dumduma po itong plasmins action kanina. Okay. Again ha, ang mechanism of action ng gamot na thrombolytics. Thrombolytics, may kinalaman yan sa plasmin pathway. So, sa next video, balikon ra gihapon nato ang plasmin pathway. Okay. And finally, we have the pro-thrombotic agents. Okay, So, pro-thrombotics naman, they cause clotting. Di ba? Kay pro-thrombus, of course, they causes clotting. Okay, or they causes clot formation. Okay, so I repeat, we have anti-thrombotics, thrombolytics, both causes bleeding. Okay, then we have pro-thrombotics, ito naman, clotting. Okay, so these are the three major classification of drugs for coagulation disorders. So let us now start with antithrombotics. Okay, the antithrombotic agents. Specifically, di ba dalawa yung antithrombotics? We have antiplatelets, anticoagulation. So, we will start with, ayan, the anticoagulants. Okay, the anticoagulant agents. Kasi mas heavier. Mas heavier yung informations under this segment compared to antiplatelets. So, we will begin with this anticoagulants. Okay. Recall natin that anticoagulants are agents that can interfere with the blood coagulation cascade by targeting the clotting factors. Diba? Anticoagulants, they target the coagulation cascade. Now, with regards to anticoagulants, there are two classes of anticoagulants based on their MOA. Okay, or mechanism of action. Number one is the direct thrombin inhibitors. Second is the indirect thrombin inhibitors. Now, when we say direct thrombin inhibitors, the term suggests that they target the clotting factor na thrombin. Diba? Yung thrombin, anong clotting factor yon? The 2A. Okay, again, for direct thrombin inhibitors, they target or they inhibit directly the clotting factor 2A. I-recall ninyo na yung clotting factor 2A, again, yung clotting factor, recall na to ha, yung clotting factor 2A, this is very important para ma-activate ang 1 forming 1A. Tama? Recall. Okay, nag-recall lang ta ha. Base niya siya sa coagulation cascade I had discussed already sa part 1. 2A, kung naaalala nyo, 2A again, 2A, siya yung responsible for 1A formation. wherein ang 1A is already a stable bridge. Siya yung strong bridge, di ba? Which is the so-called letter F, fibrin. Di ba? Yung 1A, siya yung strong bridge. So, yung nagpapastabilize ng clot, siya yung fibrin. Kaya lang, with the use of direct thrombin inhibitors, they can block the action of 2A. Okay? And syempre, inhibition of 2A, that will prevent 1A formation. Kaya, nare-retain na unstable ang bridge. Okay? So, still, very prone to dissolution, prone sa breakage yung clot. Thus, ultimately, ang effect ng direct thrombin inhibitors ay bleeding. So, nagpapa-bleed din sila. Okay? So, bleeding. So, yan yung mechanism of action ng direct thrombin inhibitors. Okay? So, generally, anticoagulants, antiplatelets, the anti-thrombotics, bleeding yun. Dumduman ninyo, bleeding yang net effect. Okay? Next is indirect thrombin inhibitors. When we say indirect thrombin inhibitors, take note, they destroy the clotting factors. Take note, green na lang. They destroy the clotting factors that activates prothrombin. Okay? That activate prothrombin. Again, indirect thrombin inhibitors. They particularly destroys those clotting factors that activates prothrombin. Okay? Recall na ang prothrombin, this is also the clotting factor 2. Diba? So, atong i-breakdown. Again, i-breakdown nato ang mga terms based on the mechanism of action. So, sabi ko, ang prothrombin, isa siyang inactive. Diba? Kay clotting factor 2, walang letter A. So, isa siyang zymogen pa. Okay? Zymogen pa siya, which is also known as the clotting factor 2. Karon, question, asa involved ang clotting factor 2? Asa siya makita sa coagulation cascade? Is it sa intrinsic, extrinsic, or sa common pathway? Kung inyong i-recall, asa involved ang clotting factor 2? Sa intrinsic, extrinsic, or common pathway? Okay. Nasa sa common pathway. So, butang ta. Ayan, prothrombin. So, example. Ayan, we have the clotting factor 2 sa common pathway. Sabi natin, ang mga clotting factors, they need to be activated. Diba? Na-mention ko to sa part 1, na ang mga clotting factors, they need to be activated para maging useful sila sa coagulation cascade. So, itong clotting factor 2, kailangan siyang maging 2A. And as emphasized, very important ang 2A, ang thrombin, para makabuo ng, anong clotting factor yon? Para makabuo ng 1A. Okay? Kaya lang, please take note na ang clotting factor 2, kaning clotting factor 2, magiging 2A lang siya kung naay help, naay tabang, okay, gikan sa mga clotting factors from extrinsic or from intrinsic pathway. Diba? Again, the clotting factor 2, ma-activate lang siya kung magtulong-tulong yung iba pang mga activated na mga clotting factors na gikan sa intrinsic and also sa naman ang arrow sa extrinsic pathway. Okay? So, kumbaga, the reason bakit may 2A, may clotting factor 2A, kay naaman po'y lain pa nga clotting factors na nagtinabanga. Okay? Gikan sa extrinsic, gikan sa intrinsic pathway. May mga clotting factors na nagtinabanga para mabuo yung 2A. Okay? So, ngayon, ang ginagawa ng mga indirect thrombin inhibitors, sisirain nila yung mga clotting factors na kailangan para mayroong 1A eventually. Okay? Therefore, ang ilahang target is yung mga clotting factors mula sa extrinsic, mula sa intrinsic pathway. Okay? And by targeting those clotting factors, end result, walang 2A eventually. And syempre, kapag walang 2A, wala na ring 1A. Okay? So, tawag sa kanila again, kapag ang anticoagulant can destroy those clotting factors that activate, okay, the prothrombin. Those are indirect thrombin inhibitors. Okay? So, discuss natin sila, yung mga subclasses ng anticoagulants individually. Okay? So, una tayo sa direct thrombin inhibitors. Okay? So, basically, basta direct thrombin inhibitors, they are also being referred to as direct anticoagulants. Again, basta direct thrombin inhibitors, they are also referred to as direct anticoagulants. Because again, they directly block 2A. Okay? They directly block thrombin, which is the clotting factor 2A. So, may dalawang classes ng direct thrombin inhibitors, and this is based on route of administration. Okay, so we have the parenteral and the orally administered DTIs, okay, or direct thrombin inhibitors. First is we have parenteral. Under this are the following: hirudin, lepirudin, bivalirudin, argatroban. Regarding hirudin and lepirudin, they are somehow related from each other, only that ang hirudin ay natural. Okay? Yung hirudin is natural. Whereas yung lepirudin, ito naman ay synthetic. So again, take note, hirudin natural, synthetic naman yung lepirudin. Ang hirudin naturally ay extracted from leech saliva. Ang lepirudin naman, siya yung recombinant form of hirudin. Now, bakit may recombinant form or synthetic form ang hirudin? Um, this is actually because since ang hirudin comes um, from an animal, so natural, kumbaga natural source siya, galing siya sa isang species ng animal, there is a tendency or mataas ang tendency or mataas ang risk of hypersensitivity. Okay? So, yan yung kumbaga disadvantage. Okay? Higher or mataas yung risk ng wrong spelling, hypersensitivity. Okay? Reaction. Again, since ang hirudin again, it comes from a natural source, mataas yung risk ng hypersensitivity reaction. Okay? Kumbaga, mataas yung tendency ng allergic reaction. That is why merong recombinant form para somehow maiwasan ang hypersensitivity reaction. And also, parenterally administered yung bivalirudin and argatroban. Now, for orally administered naman, we have only one existing na orally administered. We have the dabigatran. Again, we only have one existing na orally administered direct thrombin inhibitor. We have the dabigatran. Kasi yung similagatran, that was already withdrawn from the market. Now, yung dabigatran, take note, this is commonly marketed under the brand name Pradaxa. Okay, Pradaxa. Ito yung common brand name ng dabigatran. Ayan. Now, for the mechanism of action, na-discuss ko na to. Diba, kanina? Na-discuss ko na yung mechanism of action ng direct thrombin inhibitors. Okay? So, quick recall lang. They directly block thrombin. So, they directly block 2A. Kung walang 2A, walang fibrin. Okay? Which is a strong clot, resulting therefore to bleeding. So let us now proceed directly to the clinical uses or therapeutic uses or clinical application ng direct thrombin inhibitors. Number one, for lepirodin, this is used in patients with heparin-induced thrombocytopenia or what we called as HIT. Okay, so pharmacology, this is usually abbreviated as HIT. Okay, take note, first line niya siya, ng lepirodin. First line in patients with HIT. Okay, first line. Okay, lepirodin. Later, we will talk more about heparin-induced thrombocytopenia pag moabot na ta sa heparin. Okay. Also with bivalirudin, it is also used in the treatment of post PTCA. Okay, tama ba? Post PTCA. Okay, PTCA. Okay, yung PTCA, that is an angioplasty. Isa siyang angioplasty procedure which stands for, ayan, percutaneous transluminal coronary angioplasty. Okay, so yan yung bivalirudin. Also, we have argatroban. Ang argatroban naman, this is used as an alternative to HIT. Okay, take note. This is used as an alternative to patients with HIT, with or without thrombosis and coronary angioplasty. Okay, That's for argatroban. And for the orally administered drug, okay, for the orally administered drug per oral, um, yung dabigatran, ito naman approved for use in Europe. Actually, even here in the Philippines, naatay dabigatran. Okay, available na siya sa Philippines. Dabigatran orally administered na direct thrombin, excuse me, inhibitor. Okay, ito naman often used as alternative, take note. Ito naman alternative siya to warfarin. Okay, alternative siya to warfarin when a patient has a venous thromboembolism. Warfarin. Okay. Again, alternative siya to warfarin to patient with venous thromboembolism. Okay, who have undergone hip or knee replacement surgery. Okay, so that is for the clinical uses, clinical applications of direct thrombin inhibitors. Okay, so sa separate video, you'll be able to learn as well the pharmacology ng drugs na na-mention, yung warfarin. Ay, sorry. Ayan. Okay. So, sa next nga video, ma-present dito ang pharmacology ng warfarin. Okay? So, overall, these are the examples of direct thrombin inhibitors, parenteral and orally administered. Okay, now let us proceed to the indirect thrombin inhibitors. Again, we are now on to indirect thrombin inhibitors. Remember, ang mga indirect thrombin inhibitors, they can destroy the clotting factor, okay, that are needed to produce 2A. Okay, so indirectly, gina-inhibit nila ang thrombin pero via targeting those clotting factors that helps form thrombin. Okay, so usually, yung na-mention ko kanina, they target the clotting factors that act in the extrinsic or in the intrinsic pathway, or in some cases, those clotting factors in the common pathway. Okay, so same with direct thrombin inhibitors, we have two classes here. Two classes of indirect thrombin inhibitors. Based ganun pa rin, based in route of administration. Okay, so for parenterally administered, we have heparin. And then for orally administered, we have the warfarin. Okay, for orally administered agent, ang mas i-focus na to is yung warfarin. Although, there are actually newer agents. Okay? There are newer agents na orally administered indirect anticoagulants. Examples are the apixaban, and also we have rivaroxaban. Okay? Again, orally administered din ang apixaban and rivaroxaban. Okay, these agents in particular, these are oral 10A inhibitors. Okay? Again, they are orally administered na ganun din, indirect thrombin inhibitors, particularly they inhibit 10A na clotting factor. Okay? Again ha, 10A is isang clotting factor. So, classified din ang apixaban, rivaroxaban as anticoagulant in general kasi it targets a clotting factor which is a 10A particularly. Now, para dali ra ninyo madumduman na ang apixaban, rivaroxaban, they are 10A inhibitors, clotting factor 10A inhibitors. Sa inyong notes, when you transcribe this, when you take down notes while upon access aning lecture video, whenever you write the word apixaban, inyuhang i-capitalize ang letter X. Okay, ganun din sa rivaroxaban. Para dali rin ninyo madumduman nga 10A inhibitors sila. Okay, they target, ayan, 10A, 10A, clotting factors. Okay, so that is how I remember apixaban, rivaroxaban as 10A inhibitors. Now in this case, since targeted ang 10A clotting factor, obviously indirect, diba? Indirect action or indirect yung inhibition na nangyayari for the formation of thrombin. Kasi hindi 2A yung target nila. Tina-target nila is 10A. So, indirect. Indirectly nila gina-inhibit ang formation ng thrombin. Now, one advantage of using sabans, using apixaban, rivaroxabans, mga newer agents orally taken, wala silang monitoring required. Okay, so take note, no drug monitoring is required. Okay, required. Okay, again, yung advantage with using sabans, okay, no drug monitoring is required. Ano naman advantages kung no monitoring required ang usa ka drug? Take note na kapag yung drug hindi kailangan ng monitoring, that only tells us na ang gamot ay safe. Okay, that only tells us na ang gamot is said to be safer. Okay, pag ang gamot kasi, or let's say monitoring is done for a certain drug that is being administered sa patient, that tells us na ang gamot could really be toxic kasi kailangan ng monitoring. Diba? So, toxic ang gamot kapag kailangan ng, or potentially, hindi toxic, but potentially toxic siya kapag kailangan ng drug monitoring yung gamot that is being administered sa katawan ng tao. So, the fact here, the fact na hindi na kailangan ng drug monitoring, it would be safer then. Okay? It would be a safer drug. Okay? So that is for the newer agents. Okay? The apixaban and rivaroxaban. Now, ang mas i-discuss natin, of course, sa proceeding ng mga videos in detailed is yung warfarin. Okay? So, bago yung warfarin, we will start now detailed discussion with heparin. Okay? So, heparin bago yung warfarin. Okay, so we will start now with heparin. Again, isang parenterally administered thrombin inhibitor. Okay? Heparin, particularly as stated, considered siya as a mixture of sulfated mucopolysaccharide. So, this only means polysaccharide. So, isa siyang carbohydrate. Diba? Take note, please keep this in mind na ang heparin, isa siyang carbohydrate. So, isa siyang CHO, CHO. Diba, carbohydrate, merong carbon, hydrogen, oxygen. Okay, so heparin isang carbohydrate. Okay, so dumdumi ni siya. Kay naan ni siya implications later pag-abot sa toxic effects ng heparin. Okay, so please don't forget, heparin is a carbohydrate. So may relationship to, may implications to sa kanyang toxicity. Okay, so mamaya, discuss natin yung toxicity. Now, based on the sizes of heparin, merong dalawang forms ng heparin. Okay, again, based on the size. Okay. Ayan. So, depende kung malaki or maliit yung heparin. So, number 1, we have the regular. Okay, yung regular heparins, or these are also the high molecular weight. Okay, high molecular weight heparin, or also known as unfractionated heparin. So, take note, unfractionated heparin is also the regular heparin. Second, we also have the low molecular weight heparins. Okay, so under this are the following. We have enoxaparin, dalteparin, tinzaparin, fondaparinux, yung danaproid. Okay, danaproid. Again, these are the low molecular weight heparins. Okay. Now, tandaan, merong certain differences ang forms, yung dalawang forms ng heparin. Actually, differences in terms of mechanism of action, in terms of route of administration, and even sa monitoring. Okay? So, nasa sila certain differences. So, discuss natin ngayon, una ta sa mechanism of action. Okay, MOA ng heparin. Okay. Now, in terms of its mechanism of action, heparin, take note, heparin, it binds to antithrombin 3. Okay. So, familiar naman kayo sa antithrombin 3 na mention ko siya kanina. Okay, again, yung heparin, it binds to antithrombin 3. Again, na-mention ko earlier yung antithrombin 3. Recall that antithrombin 3 normally, ang effect nito sa katawan is, ano yung effect ng antithrombin? Clotting or bleeding. Recall ng antithrombin 3 normally ang effect sa katawan is, yes, bleeding. Okay? Normally. Kaya lang yung problema with antithrombin 3 alone, again ha, antithrombin 3 alone, yung problema sa kanya is mabagal. Mabagal yung ability niya to cause bleeding. Again, antithrombin 3 alone, yung problema, disadvantage is mabagal yung ability niya to cause bleeding. Now, sabi ko kanina, ano yung action ng heparin? Example, this is heparin. It binds, di ba? Kaya niyang mag-form ng complex with antithrombin 3. Okay, it binds to, AT3. It forms an active complex with antithrombin 3. Now, tandaan, kapag ang heparin nakapag-form na siya ng active complex with antithrombin 3, take note na yung rate of reaction is being enhanced by 1,000-fold. Again, kapag nakapag-form ng active complex na gani ang heparin with antithrombin 3, nakapag-bind na siya sa antithrombin 3, yung rate of reaction, yung rate ng action ng heparin or ng antithrombin 3 na enhance 1,000-fold. What does it mean? It only means na yung typical na trabaho ng antithrombin 3 bumibilis by 1,000-fold. Okay? Bumibilis by 1,000 times kapag andyan si heparin. Okay? Now, kapag increased yung rate of action, it would mean na enhance ngayon ang activity ng drug. Okay? So, yan yung nagagawa ng heparin with antithrombin 3. Now, dire, nadayon mo sulod ang certain variations. So, dito na part na magkakaroon ng certain variations. Depende kung unfractionated heparin or low molecular weight heparin. Okay? So, in here, what I am trying to tell here is, although they target antithrombin 3, magkakaroon sila ng variation sa mga clotting factors being targeted. Okay? So, dira sila mag-differ. Okay? Now, kapag regular, tandaan, kapag regular gani na, ayan, regular heparin, by binding to antithrombin 3 via forming active complex with antithrombin 3, there are several nga mga clotting factors being targeted. And these are the 9A, 10A, 11A, 12A, 13A. And in some cases, may 2A. But this is very rare. But there are really cases na 2A. This is kapag regular heparin. Now, kapag naman low molecular weight heparin, very specific yung action niya towards targeting 10A. Okay? So, sa targeted clotting factor sila nag-iiba. But their similarities is targeting forming complex with antithrombin 3. So that's for the mechanism of action ng regular at saka low molecular weight heparin. Okay? Now, another figure that explains the mechanism of action ng heparin, so ayan, is ito. Ito yung another figure, another illustration that would explain the MOA ng heparin. So we have here, for instance, the antithrombin 3. So, narang antithrombin 3. Now, we also have here for instance, the UFH unfractionated heparin. Okay, so again, ano yung ginagawa ng heparin? Generally, they form active complex with antithrombin 3. So together, they will form active complex. Kaya, ayan. After forming complex, what will happen? Maraming clotting factors are then being targeted, such as 10A, what else, and other clotting factors that would activate clotting factor 2. And in some cases, thrombin will also be targeted. Whereas, kapag low molecular weight naman na heparin, very selective yung action niya, okay, or action ng complex, okay, sa clotting factor 10A. Okay? So, again, yan yung difference ng dalawang forms ng heparin. Okay, now let us proceed to the clinical uses. Okay, again, let's proceed to the clinical applications, uses. Okay, so the following are the clinical applications of heparin. Number one, this agent is being given when initiating anticoagulation therapy. Okay, this is because of faster onset of action of the drug. Kumbaga mabilis yung bleeding effect ng heparin. Approximately, sorry, ayan, approximately yung bleeding effect niya is within 6 hours. Meron na siyang bleeding effect. Okay, approximately for 6 hours, may bleeding effect na yung heparin. And this, take note, this plays an important role during warfarin therapy. Okay, warfarin therapy, again, important ito in the conduct of warfarin therapy. Okay, so sa next videos, pag ma-discuss na ang warfarin pharmacology, ma-mention dito utro ang heparin. So take note ha, heparin, ginagamit siya pag gusto nato sugdan ang bleeding effect during warfarin therapy. So initiating warfarin therapy. Next, management of acute coronary syndrome. Usually, ang ginagamit dere is yung mga low molecular weight heparins. Okay, also, treatment and prevention of pulmonary embolism. Okay, actually, meron tayong mga applicable routes. Okay, may mga applicable routes of administration in using heparins depending on the size, also depending on the purpose of the application. Tandaan, kapag unfractionated heparin for prophylaxis, take note, for prophylaxis na purpose, or pag sabi prophylaxis prevention na purpose, ang route of administration kapag unfractionated heparin ay subcutaneous. Okay? And then kapag for treatment purpose naman or application, the route of administration is intravenous. Okay? Intravenous administration. Again, prophylaxis, subcutaneous, treatment, intravenous. Okay? Kapag naman low molecular weight heparins, take note, kapag low molecular weight heparins, prophylaxis either prophylaxis man or treatment, ayan, treatment, the same lang. Okay, same lang ilang route of administration, and that is subcutaneous. Okay? So, yan yung dalawang possible routes of administration using heparins. Okay? For pulmonary embolism, treatment and prevention. Okay? Next, another clinical use of heparin is for the management of deep vein thrombosis and when anticoagulation is necessary during pregnancy. Tandaan, in pregnant women, sa pregnant women, nga kailangan talaga ng anticoagulant, ang ginahatag is low molecular weight. Okay, na heparins. Again, they are given low molecular weight heparins for pregnant women that needs anticoagulant. Bakit low molecular weight heparins? Obviously, because comparing to the regular heparins, low molecular weight heparins mas safer. Diba? Mas safer sila. So overall, these are the clinical uses of heparin. Okay. Now let us proceed to the monitoring. Okay. So, ano ngayon yung importance ng monitoring of the drug heparin once ma-administer siya sa katawan ng tao? Important ang monitoring in this case because ang heparin is said to be potentially toxic. Take note, heparin is said to be potentially toxic. And take note, ang drug monitoring in here is conducted when unfractionated heparin is used or being administered. Particularly kapag ang route of administration ng unfractionated heparin is via intravenous infusion. Okay? So, yan yung relevance ng drug monitoring for unfractionated heparin. But for low molecular weight heparin, kapag ang gamot, low molecular weight heparin, walang monitoring required. Again, kapag low molecular weight heparin, walang monitoring. No monitoring is required. Okay? That is why between two forms, mas safer yun ang low molecular weight heparins. Now, for unfractionated heparin, syempre, siya yung may kailangan ng monitoring. Particularly, the monitoring being done sa unfractionated heparin is called blue na lang. APTT. Again, APTT. Yan yung monitoring being done sa heparin. APTT, this stands for activated partial thromboplastin time. Plastin. Again, APTT. That stands for activated partial thromboplastin time. Okay? And ang monitoring na APTT, of course, it has a goal. Okay? Meron siyang goal. Okay? Any type of monitoring, dapat naman gid na goal. Okay? Bantog kailangan i-monitor. And ang iyang objective, of course, is to identify nga ang heparin is still safe to that patient. Okay? So, importante na siya ang goal, ang objective that would help identify nga ang heparin is still safe pa ba or hindi na safe. Okay? So, ang goal is dapat, take note, ang goal sa APTT, di ba, it has something to do with time. Okay, so dapat ang goal, ang range ng result of APTT must have a time range of 60 to 85 seconds delay in clot formation. Okay. Ayan. So, ayan yung goal dapat ng APTT. Again, ang goal, there must be a 60 to 85 seconds nga range of delay in clot formation. So, let's try to analyze. Sabi dito, delay. Diba? Delay ng clot formation. Pag sinabing delay, sa typical or normal na proseso ng clot formation ng isang tao, dapat pag nagbigay ng unfractionated heparin sa tao, dapat mag-delay sa ang clot from 60 to 85 seconds. Okay? So the drug is given already. And since yung drug, remember, sabi ko ang heparin as an anticoagulant, they cause bleeding ultimately. So normal na nagde-delay ang clot formation for 60 to 85 seconds. Now, if ang result ng APTT pasok sa range na to, that would mean okay pa, safe pa ang heparin sa tao. Okay? Susulat ko ha. Heparin siya ha. Sa heparin na monitoring APTT goal 60 to 85 seconds delay in clot formation. Now, ang pangutana, unsaon karon kung wala kasulod sa range? Okay? What if hindi na-achieve ang objective along the monitoring? Hatag kog example or scenario. What if, for instance, less or paano ba yan? Less than the goal. Okay, for example lang ha, tip ko ano siya, hypothetical. Example, for instance, mababa or less than the goal. Example, 35 seconds. Okay, 35 seconds. Hypothetical lang siya, hypothetical. So, instead na ang APTT within the range of 60 to 85 seconds, ang resulta is 35 seconds. Okay? So, 35 seconds lang yung delay ng yung delay bago mabuo yung clot, bago yung clot formation. Therefore, in this case, this would tell us na ang formation karon sa clot is faster. Tama? Okay, 35 seconds naman ang delay ng clot. So, bago ang clot, okay, 35 seconds lang ang time range, then clot na dayon. So, therefore, faster karon yung formation ng clot. Now, kung faster ngayon ang clot formation, ibig sabihin nito, kinulang ang pagbigay ng heparin. Kulang ang dose. So, may medical term kung kulang ang dose, under dose siya with unfractionated heparin. Underdose kasi bumilis yung clot formation. 'Di ba ang atong gina-expect kay heparin as an anticoagulant, dapat tumagal ang clot formation kasi nga nagpapa-bleed ang heparin. 'Di ba? Since heparin targets several clotting factors, so dapat iyahang effect bleed. So, yung ginagawa ng heparin, pinapatagal niya yung clot formation. That's why 60 to 85 seconds delay in clot formation. Yan yung goal dapat for unfractionated heparin. No, kapag more than naman, paano naman kapag more than the goal? Halimbawa, hypothetical, 100 seconds. 100 seconds ang APTT. Obviously opposite, overdose. Diba? Overdose na yung tao, toxic dose na yan ng heparin. Kasi sobrang delayed yung clot formation. So kung sobrang delayed, ine-expect natin dito na sa loob ng katawan ng tao, excessive na yung effect ng heparin. And that could lead to hemorrhage. Okay? So in short, kapag less than the goal, it can potentially cause thrombosis kasi ang bilis ng clot formation. Okay? And then kapag naman more than the goal ng APTT, that could potentially lead to bleeding. Okay? So that is the monitoring for unfractionated heparin. Okay. Now let us proceed to the adverse effects. So the following are the toxic effects and other effects brought about by heparin. Of course, ang extension, ang prolonged, pag prolonged use ang heparin, okay, yung extension effect ng heparin, that would be bleeding, of course. Okay? Kasi base yan sa mechanism of effect ng heparin as an anticoagulant. It has bleeding effects, so excessive use of heparin, bleeding good. Okay? Or that can cause hemorrhage. Diba? Pag bleeding, hemorrhage. Okay? Now, that is why, as mentioned earlier, sabi ko kanina, di ba? Yung kaninang slide, close monitoring is required or recommended. Particularly, need ang monitoring kapag high molecular weight heparin is given to a patient. And whenever bleeding occurs with heparin use, we usually have an antidote. Okay, so na yung antidote. Pag during heparin toxicity. And yung antidote, take note, during heparin toxicity is the protamine sulfate. Okay? Protamine sulfate. Again, it is protamine sulfate. So later, discuss ko yung rationale of using protamine sulfate as an antidote for heparin poisoning. Now, another toxicity, heparin must be used in caution sa mga hypersensitive patients. Okay? And also, there could be adverse effect na alopecia. And also, kapag prolonged use ang heparin, it can activate or it can induce bone resorption. Okay, again, it can induce bone resorption. When we say bone resorption, ibig sabihin yung calcium ion deposits, okay, from the bones, yung calcium deposits from the bones, naglulus. Okay, nalulus sila. So, from the bones na pupunta sa blood. Syempre, kapag ang calcium deposits sa bones nababawasan, that could lead to osteoporosis. Okay? And then it can also accelerate the clearing of postprandial lipemia, okay, by causing release of lipoprotein lipase from the tissues. In short, ang heparin, it can lower the blood triglyceride levels. So, yan yung meaning ng bullet fourth. Okay, ang heparin, it can lower blood triglyceride levels. Another, we have yung HIT, heparin-induced thrombocytopenia. And finally, mineralocorticoid deficiency, or this is the aldosterone deficiency. Okay? So, sa mga adverse effects na to, I'll give emphasis sa bleeding effect, and also sa heparin-induced, most especially heparin-induced thrombocytopenia. Okay? So, I'll start with, ayan, heparin-induced thrombocytopenia. Una, ang HIT or heparin-induced thrombocytopenia. This is actually a rare nga na adverse effect. Okay, sulit ko ha. Rare. Isa siyang rare adverse effect caused by heparin. And this is characterized by immune mediated. So, immune mediated siya. Mediated thrombosis. Okay. And also, characterized by thrombocytopenia. Again, this condition is characterized by immune-mediated thrombosis and also thrombocytopenia. Okay, so rare side effect caused by heparin. So, ano ibig sabihin ng immune-mediated thrombosis tsaka thrombocytopenia? So, unahin natin yung thrombosis kasi familiar naman kayo sa term na thrombosis. When I say ano ba yun? Thrombosis. Okay? Diba? This term is related to the word clot. Thrombus. Clot. Okay? So, yan yung thrombosis. Next, dito naman tayo sa thrombocytopenia. Kapag sinabi natin thrombocytopenia, based on laboratory results na identify sa lab test na kapag may thrombocytopenia, ibig sabihin mababa ang thrombocytes based on the lab results. Okay? Mababa daw ang thrombocytes ng tao. And recall, thrombocytes is also known as thrombocytes, platelets. So, kayo na mag-spell out. So, mababa ang platelets ng tao. Yan yung thrombocytopenia na condition. Again, based on lab results, deficiency ito ng platelets, thrombocytopenia. Hypothetically, kapag mababa ang platelets, hypothetical ha, kapag ang tao mababa yung platelets niya, hypothetically, we would expect na prone ang tao sa bleeding. Diba? Kapag mababa ang platelets, hypothetical, pwede siya mag-conclude na okay, prone siya sa bleeding. Kasi nga mababa ang platelets. So at first, we would really think that way. Okay? Mababa ang platelets. So expected na dapat ang tao prone to bleeding. Pero listen, bakit nakalagay dito na clot, thrombosis, may clotting. Tapos the rin na part, contradicting siya. Diba? Mababa ang platelets, bleeding. So, contradicting siya diri nga part na ay clot, bleeding. So, unsa man gid ng heparin-induced thrombocytopenia nga condition. Okay? So, discuss ko ngayon ano yung relationship ng mababang platelets sa clot. Okay? So, number one, we have to remember that heparin is a carbohydrate. Okay. So, magbutang sa akong barrier. Take note, yung heparin, sabi ko kanina, as emphasized, isa siyang carbohydrate. Meaning, meron siyang carbon, hydrogen, oxygen, isa siyang carbohydrate, mucopolysaccharides. So, akong gina-emphasize na carbohydrate ang heparin kasi may kinalaman ito sa concept na immunogenicity. Immunogenicity. Okay? Sa katawan ng tao. Now, if you recall microbiology, sa immunology nga segment sa micro, ang common rule when we talk about immunogenicity is that ang may kakayahan na mag-activate ng immune system ng tao is mga chons. Okay, again, If you recall microbio, kung mag-topic yung immunology, when it comes to immunogenicity rule, ang naalay power, ang naalay ability to activate our immune system is mga chons, mga proteins. Okay? Diba? Chons sa biochemistry, proteins. Carbon, hydrogen, oxygen, nitrogen. Take note ha, common rule yan. Proteins ang nag-activate ng immune system natin. Now, since heparin na gamot, isa siyang carbohydrate, somehow, ang heparin pag na-administer yan sa katawan, inside our body, it can be invisible. Okay? Take note, si heparin as a carbohydrate na gamot, kung ma-administer gani siya sa katawan ng tao inside the body, it can be invisible. Okay? Kapag sinabi nating invisible yung drug, kahit galing siya sa labas, okay, isa siyang exogenous substance, meron siyang ability na hindi siya kayang matraced. Okay? It cannot be sensed by our immune system. Again, by the immune system ha. Kahit exogenous substance siya, it cannot be traced, it cannot be sensed by our immune system. Kaya nga, ang tawag natin sa drug na to, sa drug na invisible sa immune system, or let's say non-immunogenic. Kapag ang drug invisible sa immune system or non-immunogenic, at first, isa siyang hapten. Okay? So, I hope familiar na mo sa term nga hapten. This is hapten na mga drugs, ma-introduce na siya sa Pharm Chem 2. Okay? So, si heparin, again, kaya niyang, isa siyang gamot na can be invisible sa immune system, or pwede siyang tawagin as non-immunogenic. Okay? So, kapag ang gamot, again, invisible sa immune system, that is termed as hapten. Okay? So, ang heparin, it cannot be identified at first sa immune system. Actually, halos lahat ng hapten na gamot, mga carbohydrate moieties sila. Okay, so included na doon si heparin. Now, ano yung prerequisite para ang hapten ma-sense na ng immune system? Kasi 'di ba at first hindi nga siya nasa-sense yung heparin. So, ano yung prerequisite para ma-sense siya ngayon ng immune system? Now, para ma-sense ng immune system ay isang hapten, dapat ang gamot, it has to bind to a protein. Okay? So, yan yung prerequisite ngayon ng isang hapten para ma-sense siya ngayon ng immune system. Dapat makapag-bind siya to a protein. Okay? Or a physiologic protein. And in the case of heparin, dapat dumikit siya sa protein na platelet factor 4 in particular. Okay? Platelet factor 4. Dapat siya ay dumikit kay platelet factor 4. So, for example, so let's illustrate Illustrate na ako. Example, this is heparin. which is again, at first, isa siyang hapten kasi siya ay carbohydrate originally. So, as I've said, para ma-sense ng immune system ngayon ang isang hapten, kailangan yung heparin makapag-bind to a protein, particularly the platelet factor 4. Ayan. Okay. So, when the time comes na nakapag-bind na yung heparin sa platelet factor 4, ang tendency, ma-activate ang immune system. So, this time, from non-immunogenic, ma-immunogenic na siya. Okay? This time. Okay? Kasi yun yung prerequisite para ma-sense na ngayon ng immune system ang isang drug na hapten. So, kung maabot na gani ang time nga mo-bind na ang heparin sa isang protein, immunogenic na siya this time. And when this happens, that causes attack brought about by immunoglobulins kasi na-activate na yung immune system, na-sense siya ng immune system. So, there will be attacks by immunoglobulins. So, pupunta dyan ang mga immunoglobulins. For example, ito yung representation kasi usually ng mga immunoglobulins. Diba? Usually nga ni pag-represents ang mga immunoglobulins. So, example, representation natin ng antibody, particularly the immunoglobulin G. Okay? So, i-a-attack ito ng immunoglobulin G, the IgG. Okay? So, didikit yung IgG sa complex. So, take note ulit, without these complex, yung unang complex, heparin binding to platelet 4, walang immunoglobulin. Tama? So, ngayon, meron na tayong complex ng platelet factor 4, heparin, and IgG. Now, ano ngayon yung implication kapag may complex na ng heparin, platelet factor 4, and immunoglobulin G? So, sa illustration ko, I will label this complex, kaning tulunga complex, as star na lang. Okay? Ayan. So, illustrate ako ng blood vessel. Example, this is the blood vessel. Okay, example lang. Yan yung blood vessel. And remember, ano yung innermost layer ng blood vessel? Innermost layer ng blood vessel is the endothelium. Okay? Black na lang. Okay. Now, I've discussed already that with regards to platelets, example, blood na siya, freely flowing. With regards to platelets, normally, platelets, these are normally resting. As long as they see endothelium, they will remain resting. Okay. However, take note, because of the presence of the complex, okay, itong whole complex na to, this could serve as trigger, okay, for clot formation. Again, kapag andyan na yung complex, present na yung complex, again yung star ha, kaning star, it represents the complex of heparin, the factor 4, at saka yung IgG. Again, because of the presence of that complex, that could serve as trigger for clot formation. So that means na kahit walang sira ang endothelium, walang injury sa endothelium, walang trigger for clot formation, that causes platelets to adhere. Okay, mag-a-adhere yung mga, okay, erase ha. So, from resting na mga platelets, mag-a-adhere sila ngayon. Okay? Kaya ang mga platelets nag-a-aggregate doon sa site kung nasaan yung complex. Okay? So, ayan. And when the aggregation takes place, thrombosis will happen. Mhm. Again, I repeat, um, whenever whenever the aggregation takes place, here, kapag nag-a-aggregate na sa complex yung mga platelets, thrombosis will take place. Okay, formation of clot will occur. Kasi nga, yung complex na yun yung nagsisilbing trigger ng thrombosis doon. Okay? Again, mayroong, sulat ko ha, mayroong thrombosis na. So, check na yung thrombosis. Okay? Now, ang problem ngayon, sa heparin-induced thrombocytopenia, abnormal ang deposition ng platelets. Okay? Kaya pag nagkakaroon ng excessive deposition of platelets, ang tendency yung mga freely circulating platelets nababawasan kasi nga naiipon sila doon sa isang site. That is why pagdating sa laboratory test results ng patient, kapag nagpunta siya sa lab for blood testing, makikita na sa measurement mababa ang platelets. Okay? Mababa yung platelet count sa blood. Kasi nga, for instance, ito yung syringe. Syringe yung needle ng syringe. Okay? So, for instance, nag-extract na ng blood from the patient. So, from the syringe, syempre, kapag nakapag-extract na ng blood, yung freely flowing, freely circulating na mga blood, sila yung mga na-extract. Again, yung mga freely moving, circulating na blood, yun yung na-extract. And since ang mga platelets nagde-deposit sa isang site, doon sa may complex, ang blood na na-extract kokonti lang yung circulating platelets. Kaya nga sa measurement, mababa. Mababa talaga yung platelet level being reflected sa lab test records. That is why, kung mababa ang measurement ng platelets, that is the condition called thrombocytopenia. Okay? So that is the gap between thrombosis having clot, okay, thrombosis having clot, and then yung pagkakaroon ng mababang platelet counts, okay, during heparin-induced thrombocytopenia. Okay, so this is a very rare immune-mediated na adverse effect ng heparin. Okay, so heparin-induced thrombocytopenia. Okay, that is why if you remember sa previous slide, ano yung treatment? Ano yung first line treatment for HIT? Anticoagulant din. Kasi nga, merong thrombus na nabuo. So, yung first line is lepirodin. Okay? Again, kailangan din ng anticoagulant for this condition kasi nga, may accompanied thrombosis sa thrombocytopenia. So overall, that's the heparin-induced thrombocytopenia. Next, yung isang adverse effect ng heparin, yung bleeding, later na ako siya i-discuss in detail kay i-relate na ako siya sa treatment of heparin poisoning. So let us have the contraindications. The following are the contraindications of using heparin. Kung moingon ganitag kontra indications, these are the events na nagiging rason para di dapat gamitin yung patient. Hindi dapat gamitin ng patient yung gamot na heparin. Okay, so bottom line ani tanan sa mga listed conditions, kini sila tanan mostly na ay associated nga active bleeding. Okay, again, yung most of the listed conditions na sila'y associated active bleeding. Okay. So, na sila'y active bleeding already, syempre, kapag may active bleeding na kaakibat, bawal gid ihatag ang heparin. Common sense lang, heparin causes bleeding. That is why bawal siya sa mga may active bleeding associated conditions. Okay, so example, if ang patient may hypersensitivity, hemophilia, purpura, hemorrhage, etc. etc. Next, contraindicated din ang heparin among patient recently had surgery sa brain, sa spinal cord. In short, after ng surgery procedure, syempre, hindi pa totally healed ang mga sugat. So, very prone pa sila sa bleeding. So, bawal gid ihatag ang heparin. Kasi nagkukos ng bleeding yung heparin. Then, among pregnant women naman, heparin has to be used in caution. Usually, sabi kanina, low molecular weight heparins are the ones given to pregnant women. Okay? Now, other examples ng active bleeding associated na mga conditions would be, for instance, women during their menstruation. Okay? During menstruation period ng women, that is also contraindicated din yung heparin for that condition. Also, kapag may hemoptysis, okay, hemoptysis, yung patient, bawal din yung heparin. Okay? Hemoptysis, that is a condition wherein nagsispit ng blood ang patient. So, example din yan ng active bleeding. So, overall, yan yung mga contraindications ng heparin. Then finally, and for the treatment of bleeding caused by heparin, as I've said, um, isa sa mga adverse effect ng heparin use is excessive bleeding. And it can be treated with protamine sulfate. So what is the rationale behind the use of protamine sulfate? Actually, yung reaction ng gamot is to counteract poisoning from heparin has something to do with neutralization reaction. Neutralization reaction. So somehow, naana mo yung idea, ani, because I had introduced this already under lesson 1, if you can still remember. Heparin poisoning, protamine sulfate yung antidote. Now, when we say neutralization, that is a reaction between acid and a base. Kaya yung neutralization. Tandaan, ang heparin dito, siya yung nag-act as an acid. So, kasi nga, isa siyang acidic drug. Okay, so heparin, isa siyang acidic drug. So, ngayon, kapag ang patient is already suffering from heparin poisoning, ang goal ngayon is excretion na of the drug. Now, para ma-excrete yung gamot, ang gina-administer is the protamine sulfate. Okay, and as stated in this slide, protamine sulfate is highly basic. Okay, and now observe sa reaction, we have an acid and a base, causing therefore neutralization reaction. Now in pharmacokinetics, neutralization reaction, when it happens, yung heparin will now form its ionized form. Diba? Kapag nag-undergo na og neutralization reaction ang heparin upon interacting with protamine sulfate, of course, heparin will now form its ionized form. Ibig sabihin, kapag ionized form na, excretable. Diba? Excretable form na yan ng heparin, ready for excretion. Now, in using protamine sulfate as an antidote for heparin poisoning, meron tayong conversion factor, conversion ratio na ina-apply. Okay, take note, in every 100 units of heparin, we usually administer 1 milligram of protamine sulfate intravenously. Okay, so for example, hypothetical lang para na application. Example, ang reason ng heparin poisoning is approximately 2,000 units. Again, what if ang reason ng heparin poisoning is approximately 2,000 units? How much protamine sulfate do you think must be administered to the patient? Ilan? Okay, ilang milligram dapat ng protamine sulfate? Okay, ang dapat i-administer to counteract the heparin poisoning. Okay. If 2,000 units ng heparin ang cause ng poisoning, so 20 milligrams of protamine sulfate will be administered or will be given to the patient. So, yan yung ratio natin to counteract heparin poisoning with the use of protamine sulfate administered intravenously. Okay, so overall, yan yung application ng protamine sulfate. And overall, we are done with heparin.